myself Smruthi, Assistant Professor from Department of Cardiovascular Technology, Yenepoya School of Allied Health Science, Yenepoya. So today my topic is about inferior vena cava filter or IVC filter. At the end of the session, we'll be able to describe what an IVC filter is, enumerate the clinical application, explain the implantation technique in detail, and describe various complications of the IVC filter. So coming to the introduction, before briefing about IVC filter, we should know about venous thromboembolism. It includes DVT, that is nothing but deep vein thrombosis, and pulmonary embolism. So deep vein thrombosis refer to the blood clots in the deep veins of our body. Deep veins are specifically seen in arms, legs and pelvic regions. Pulmonary embolism is nothing but a life-threatening condition in which the clot might break down and migrate to different parts of the body. So these DVT and pulmonary embolism are mainly treated with anticoagulants. So vena cava interruption or insertion of an IVC filter is another important therapeutic option in the management of selected patients with VTE. So when this anticoagulant is contraindicated, it will result in complication or fail to protect the patient adequately from thromboembolism. So these kind of patients can be treated with something known as IVC filter. So coming to IVC filter, it is a cage-shaped device which is made up of metals. So it is implanted in the inferior vena cava, designed in such a way that it could catch the clot and retain the clot, and it also helps in prevention of the blood clot to migrate to different parts of the body. So this is a figure of an IVC filter which shows the different parts of the filter. So we have a filter head or a hook and a stabilizing leg or a filtering leg, also known as primary and secondary filters, and then we have an anchoring hook. So this anchoring hooks mainly helps with the fixation of the device. So coming to the types of an IVC filter, we have permanent IVC filter which is designed in such a way that it could permanently hook into the IVC. So this increased risk of IVC filter if removal is attempted is a major demerit. So there is also high risk of chance when there is IVC occlusion. So it is preferred in patient with short life expectancy. So types of IVC filter, the non-permanent IVC filter, it could be convertible and retrievable. Example for convertible is Venatech convertible, which is a self-expanding conical filter which is made up of cobalt chromium metal, and retrievable, which has a smaller and thinner hook compared to the permanent ones and can be withdrawn from the body. Then we have something known as a drug-eluting IVC filter, in which an IVC filter is coated with the drugs, mainly MMPI. Its matrix metalloproteinases inhibitors is used as a drug in this. Coming to the indications of an IVC filter, absolute indications include recurrent deep vein thrombosis or pulmonary embolism despite of adequate anticoagulation, or pulmonary embolism or DVT which is contraindicated to anticoagulation, a patient with pulmonary embolism or DVT who has complication due to anticoagulants. Example is heparin-induced thrombocytopenia. Another one is inability to achieve or maintain therapeutic anticoagulation. So coming to the relative indications, massive pulmonary embolism which is treated with thrombolysis or thrombectomy, iliocaval DVT, and iliocaval deep vein thrombosis which is treated with thrombolysis or thrombectomy. We have something known as a prophylactic indication in which patient could occur a high risk of deep vein thrombosis or pulmonary embolism due to any trauma, or in case of any perioperative settings such as vascular procedures. This could also occur in patients with paralysis or prolonged immobilization. So another indication is that there is a medical condition associated with high risk of DVT or PE. Coming to the contraindication, so whenever the patient has a total thrombosis or the IVC is totally occluded, IVC filters are not indicated. Then other cases such as bacteremia, sepsis are contraindicated to IVC filter implantation. Coming to the procedure, pre-procedure we will do a venogram of the both lower extremities and the IVC. So venogram is a procedure in which we will look into the venous anatomy for any complications before the procedure. So the access site will take a contralateral access to the DVT location. Femoral vein is the preferred access, other veins are subclavian or jugular veins. Okay. where do we implant this IVC filter is in between the IVC bifurcation and the renal veins or the iliocaval duct. So the sheath, we need something known as a sheath for the implantation. We could take a 6 French to 8 French sheath is taken for the procedure. So the access is obtained by the cell denture technique and the femoral sheath is placed. Once the sheath is placed, the long guide wire is introduced to the sheath. So once the long guide wire is intact appropriately, the femoral sheath is removed and replaced with the IVC filter sheath. So after the sheath insertion is done, a contrast injection is performed. Once the injection is done, the IVC filter is advanced through the sheath and placed appropriately. We have something known as a pusher in the IVC filter, which will help in advancing the IVC filter. Once the position is accurate, the IVC filter is deployed and a final injection is performed. Then the sheath is removed and hemostasis is achieved. So this is a figure which shows the post implantation of an IVC filter. So as the IVC filter is not only about the implantation but also about the retrieval. So indications for the retrieval of an IVC filter is when there is risk of pulmonary embolism is low, anticipated by patient survival is more than 6 months, or the filter can be removed easily, or the future need of the filter is not anticipated. So this is how a device retrieval looks like. The procedure is same, the venous access is obtained, the sheath is placed. We have something known as a retrieval kit which comes with a snare. Snare has a loop-like structure which helps to hook the IVC filter and will slowly withdraw it to the sheath. Once the device is withdrawn, the system is completely removed from the body and the hemostasis is achieved. So coming to the complication of the device. So we have strut fracture mainly due to mishandling, could be due to mishandling of the device, filter migration which can be treated with retrieval or IVC surgery. Then we have strut embolization, device tilt, IVC penetration, perforation, pulmonary embolism, DVT and IVC thrombosis. So coming to the summary, IVC filter is an important therapeutic option in the management of selected patient with venous thromboembolism. So it can be permanent or optional. It is implanted in patients with VTE who are contraindicated to anticoagulants. So retrieval of these filter is performed when the patient has a lower risk of pulmonary embolism or DVT, or the filter is no longer necessary in their body. These are my references. Thank you.